Okay, well, let's get started. Good afternoon or good morning, depending on where you're joining us from, and welcome to Resilience from Farm to Plate. This is the third session of our 2020 virtual Clean Med series. Please join us for these upcoming Clean Med sessions. You can register for those at cleanmed.org. And we're excited to let you know that Clean Med 2021 will be an even larger all-digital experience. We'll share more details in the coming months, and we look forward to participation in a safe, exciting virtual Clean Med 2021 experience. And we'd like to thank Kaiser Permanente for supporting our virtual series this year. Little housekeeping here. If you have a question during the presentations, please enter them at any time throughout the session using the Q&A function. It's circled there on your screen. You'll find those controls at the bottom of your screen. We'll address as many questions as we can. We have about 10 minutes at the end of the session to address questions. And if we don't get to your questions, we'll follow up with you after the session. So I'm John Stoddard with Healthcare Without Harm's Healthy Food and Healthcare program, and I'm co-moderating this session with my colleague Lauren Poor today. So we're pleased to have two speakers covering aspects of food system resilience. David Lazaks from Croatan Institute will cover the farm level, speaking about regenerative agriculture, and Jack Breeze from Sutter Health will cover the plate level, sharing his experience with food waste prevention. But I wanted to start us off with some thoughts on what makes a food system resilient. Johns Hopkins Center for a Livable Future defines a resilient food system as one which is able to withstand and recover from disruptions in a way that ensures a sufficient supply of acceptable and accessible food for all. So considering this definition, I'd like you to take a look at this graphic on your screen, which illustrates elements of a resilient food system from farm to plate. Some core themes emerge as we think about a resilient food system. The first is healthy soil. The second is food system infrastructure in each region that can process, store, and deliver food. Equitable access to food, land, and financial resources. And finally, institutions supporting all of the above through plant-forward menus and their purchases and investments. Now, I'm going to walk us through this graphic in a little bit more detail. So starting at the farm level, healthy soils built from regenerative practices make our regions more drought tolerant, climate resistant, resilient, and food secure. Each region of the country producing a diversity of crops and aiming to meet a good portion of the caloric needs of their populations with healthy, whole, culturally relevant foods improves population health and increases food security, particularly in times of crisis. Genetically diverse livestock raised on diversified farms is a safeguard from the spread of zoonotic diseases like COVID-19. Equitable access to land and financial resources to produce food can build wealth, particularly in BIPOC communities that have been systematically denied opportunities, and can improve access to healthy, culturally relevant foods, making our populations healthier. Looking at the system level, a resilient food system has a strong food processing, storage, and distribution system in each region of the country, safeguarding from disruptions in the national supply chain. Many of us experienced food shortages in the height of COVID-19's initial spread. This was not due to a lack of supply, but due to infrastructure to get food to end users. In a resilient world, regional food systems keep money in our local economies, strengthen our communities, and provide opportunities for disadvantaged populations to learn valuable skills and start their own businesses. At the hospital level, plant-forward menus draw from the cultures of the community it serves, promote resilience by increasing demand for foods like legumes and legumes that build soil and have low climate impact. Purchasing policies that emphasize diversity, equity, inclusion can lift up marginalized communities that have been denied opportunities in the past. Minimizing food waste and having systems in place to redistribute excess food is good for the climate and improves food access in normal times and in times of crisis. Food that cannot be redistributed can be sent back to farms in the form of compost to further enrich soils. So that's sort of a completion of the cycle. Now that we've had a chance to reflect on elements of a resilient food system, I'd like to bring us back to the farm level and introduce our first speaker, David Lazaks of the Croatan Institute. In the interest of time, I'm not going to read David's bio to you, but I invite you to visit cleanmed.org to read about David's background yourself. And as a reminder, please, you can ask questions at any time during the session using the Q&A function. So welcome, David.
Thank you very much, John. Let me request remote control here. Ready to get going?
Go for it.
And we're off. There we go. So today we'll be talking, diving in a little bit on this theme of resilience from farm to plate, starting at the ground level or sometimes below the ground level, and talking a little bit about agriculture and some different kinds of agriculture that are either new or old to some production practices, depending on how you look at it. But one of the kind of the newer types of agriculture that is coming up at least in the news and in producer circles, that is actually rooted in types of agriculture that are hundreds or even thousands of years old, is this idea of regenerative agriculture. And where we've seen over the past decades, where I think the predominant discussion was around sustainable agriculture, and then also, of course, on the spectrum, we see other kinds of not only agriculture, but other kinds of systems, whether they be conventional, and we talked about them as green or restorative. But the big difference here is how we are either degenerating a system or continually kind of drawing down its resources, or how can we actually build back the resilience in these systems and really improve the outcomes and the multitude of outcomes that they're able to provide us. So when we're looking at an agricultural system or a regenerative agricultural system, we look at a number of practices that can be used to get to that state of regeneration. And when we're looking at the soil, especially in soil-based systems, it's a little bit different when you're in aquatic systems. But we're looking at a number of practices that increases the soil health, as we like to talk about. And the soil health is really about the functioning of the biology of the system, all the microbes and the small kind of critters that help to cycle carbon and nutrients and infiltrate water into that soil. And to get there, we want to take care of that soil in the best ways that we can. And to do that, there's a whole suite of practices, including diversification, or using different kinds of crops either within a year or across multiple years, doing no-till or reduced tillage, so mixing up the soil as little as possible so you don't hurt all of those microorganisms in the soil. Keeping the soil covered and using things like cover crops, which are crops that are sown in a field between when a commercially viable crop is planted, that help to both improve the soil tilth and the texture, and help to also sequester carbon. And then here in the US and in many other places over the last 100 years or so, we've done a really good job of separating our animals from the plants in many cases. So we used to have these really nicely functioning integrated animal and crop systems where we'd have animals on the farm with the crops, and you'd have this tight coupling between nutrients with manure and the fertility needs of the crops. And we've actually kind of separated those two into different systems. So thinking about not only how we can reintegrate animals back onto the farm, but also in pastures and other areas that are predominantly livestock, or livestock is the only thing that might be able to be grown or produced there, is that we're managing those in ways that, if anything, excuse me, mimic some of the natural movements of animals that like bison that used to roam on this continent and in other places. And when we do these types of practices moving toward a more regenerative agriculture, there's a plethora of benefits that can be delivered. And some of these benefits are public benefits, such as carbon storage and carbon sequestration, nutrient cycling and nutrient retention in that system. So we're not seeing these eutrophic or dead zones that you might have heard of in places like in the Mississippi River Basin and in the Gulf of Mexico. And then we also have private benefits. We can have more stable incomes. We can have increased incomes, reduction of certain agricultural inputs that might be necessary to control pests and diseases, because these systems tend to, through that improved soil health, might not need these inputs like pesticides that might have negative health implications. And so it's this suite of benefits that we are looking to try to not only value, but in order to really talk about how we can reframe some of our agricultural discussions today to move towards these systems that improve soil health through these regenerative agricultural techniques and create a more resilient agricultural and food systems. And specifically as it relates to climate, some work that we did at Croatan Institute in a paper we published last year on soil wealth, investing in regenerative agriculture across asset classes. We built on the work of Project Drawdown, which looks specifically at opportunities for mitigating and adapting to climate change, and found that climate-friendly agricultural practices could mitigate nearly 170 gigatons of carbon dioxide equivalent while generating nearly $10 trillion net financial return. And so a lot of the work that we do at the Institute is looking at how capital flows in particular can be used to transition to a more resilient and regenerative agriculture while generating these benefits for both farmers, for those communities that farmers live in, and of course, for some of these public benefits that we seek. And clearly there's some challenges in moving toward that system. And the dominant paradigm that we live in today is that we expect cheap food. We expect food to be to have a very low cost and also in some cases high quality as well. It's not like we're going out to get low quality food, but through policy, through market mechanisms, through some just global dynamics, we have really tried to reduce that cost of food. And from the perspective of communities that might not be able to afford that food, clearly benefits to that. But we also have to look at also what some of the costs are to those kinds of systems. And a paper that was put out last year looked at some of these costs of food, looking at comparing that again to the market value. And at least from these data were pulled on for the global food system that has a market value of about $10 trillion. But when you begin to add up all of these hidden costs and externalities of that system between economic impacts, environmental impacts, and health impacts, it's actually about $12 trillion, so greater than the sum of the current market value of today's global food system. And many of those costs aren't represented, of course, in the cost of food. Very rarely do we kind of connect or talk about the relationship between the externalities of food. But given that, especially high level and of high importance for this audience as well, is that you see in the slide that the majority, or $6.6 trillion of these costs, end up as a health burden. Whether it's related here, they mapped it back to obesity or undernutrition or pollution, pesticide, and antimicrobial resistance. Many of the externalities of today's food system end up squarely as the responsibility of the health sector. And so through some of these interventions, policy changes, investments in moving toward a more regenerative food system that improves environmental quality, improves economic outcomes, and of course improves some of these health outcomes as well, we see that we do have a possibility to move toward a new kind of agriculture. And one way that our team and many of our colleagues are working on is this notion of true cost accounting. So while we talk about a low cost of food and these externalized costs, how can we then come up with this true cost accounting that incorporates human capital, social capital, produced capital, and natural capital? So we're actually able to compare and contrast the full cost of these foods, and whether it's from the perspective of purchasing, from the perspective of equity-oriented decisions, from the perspective of investments and where investment dollars are going, or even how to plan either changes to or future infrastructure, how we might be able to look at trade-offs between all of these types of capital. And when we look at not only with COVID or with some of the discussions around racial equity that are happening today, is that we can envision or imagine how looking at all of these different types of capital could lead to very different decisions and very different practices than we're seeing today. And to bring this discussion home to at least in the healthcare perspective, our colleagues at Croatan Institute worked with the Democracy Collaborative and their healthcare anchor network a few years ago to work on a report on hospitals aligned for healthy communities, specifically in their investment toolkit. And in that toolkit, they highlighted the approximately $400 billion of investment capital that are held by US healthcare systems. Of course, realizing that this report is a couple of years ago, those numbers might be a little different in a mid, not quite post-COVID world. But I think the point here is that there are investment dollars held by hospitals that could be used for place-based investing. And I included the URL or the link to that at the bottom of the slide. And in that report and through some of the work that has followed on, there's been examples of healthcare systems that have done some of this place-based investing because they see the value to their communities, they see the value from addressing some of these social determinants of health, and realizing that even with a modest investment from a healthcare institution, that could help to de-risk some of these investment opportunities and bring in and leverage outside private capital as well, or public capital in addition. So while we're looking to improve our infrastructure, to transition many of these farms, and also to from the perspective of investment, look for those opportunities for return on investment, is that there are a suite of investment opportunities or ways to move capital to creating healthier, more resilient, and regenerative food systems. And just to talk about one piece that John mentioned right up front is this focus on infrastructure. And in the past, 50 to 100 years, agriculture in the U.S. and in other places as well has been really focused on consolidation and simplification. And when we look at a more regenerative agriculture, we're looking at, in many cases, the opposite of that. We're looking for a diversification, and we're looking to not only diversify some of these systems, but also to diversify across our landscape. And one piece that has been systematically deconstructed over that time period has been this infrastructure component. Here, we've been working on examples specifically related to grains, small grain infrastructure, and also regenerative meat production. So where there is pasture, or it's most appropriate to have pasture and well-managed animals, producers don't want to or can't, or it's not economically feasible to travel a long distance to a processing facility. Similarly with grains, if you're going from a two-rotation a farm, let's say in the Midwest here, we have a majority of farms that have corn and soybeans. But if you add things like wheat or rye or spelt or other small grains, or in the West and more arid regions where peas and lentils and beans can fit into those rotations, we just don't have the infrastructure on the landscape to clean, to store, to process, to mill those food products and help to get them to market, help them, whether that's into hospital supply chains or whether that's into into consumer supply chains as well. And speaking of hospitals, we see that exact same notion, whether it's vegetable supply chains, whether it's grains or meats or fruits or other things that might end up on the plate of a hospital food service, outpatient facilities, is that those supply chains, we're beginning to see a real pull from many hospital institutions of being able to connect some of the diseases and the health outcomes that they're treating in these facilities to some of the food that that either their patients or their clients or their communities might have available to them or might be provided to them, and ways to look at improving both the resilience of those of those supply chains, and also the health outcomes and the environmental outcomes. And from that perspective, it's really important to think about how not only investment dollars, but how the pull and the demand from some of these food systems, and so from these food system buyers, can be used to facilitate the creation of these more resilient and regenerative food systems. So for those of you who are buyers or work in the procurement parts of your organizations, it's just important to think about where that food is coming from, what these either internal costs or external costs are, and begin to, if the answers aren't present, begin to think about where, how we might be able to work toward creating more resilient and regenerative food systems together as a community. That's all I got. Thank you very much.
Oops. Thanks, David. Appreciate it. So with that, I wanted to just announce that we have our position statement on regenerative agriculture was just recently released. I hope some of you will go to the web link here and check it out. We outline what regenerative agriculture is, why it's important for healthcare or to healthcare, and then outline a number of different ways for healthcare to take action in supporting regenerative agriculture and regenerative practices. So there's some emerging procurement opportunities. We're seeing 3 different third-party certifications that are pretty new and in their infancy, I would say, but you'll be seeing more of those. And one simple action step to take is to ask your distributors about regeneratively produced products. Start sending that message out there that you're interested in supporting resilient food system, you're interested in supporting regenerative practices. There is, and then there's also opportunities to learn about the farms in your community and procure food directly from them to support regenerative agriculture. David spoke to the investment opportunities within healthcare. We cover that topic as well, and there's a link to the paper that David mentioned. So for those of you looking to go that route, and investment is a powerful way to usher this change along for climate and food system resilience. We cover carbon offsets, which is an emerging opportunity for some farmers. I would say it's not without its controversy in some ways, but there are efforts by some companies to monetize the carbon sequestration that's being done on farms. So there's some information on that. And then we final action step is around policy, both internally and then advocating for policies that support regenerative agriculture in your local, state, and federal government. So please check it out. And with that, I would like to invite Lauren up.
Thank you, John and David. Let me get my video on here. And let me request control of the slides. There we go. So I've been seeing in the Q&A and the chat that some of the links are not visible. So we will do our best to drop those links in the chat from David's presentation as well as from the position paper. So my name is Lauren Poor, and I'm again helping to co-moderate this session. And I wanted to pull us back to this slide that John started us off with as we sort of shift to talking about food at the other end of its life cycle. And that's food once it arrives at the hospital plate. And we're going to be zooming in today on food recovery. So this is the EPA's food recovery hierarchy, and it shows food waste recovery strategies from most preferred at the top here to least preferred at the bottom. And I'm just going to read through them in case you're not familiar with these different strategies. So at the top, and the most preferred strategy is source reduction. So that's reducing the volume of surplus food generated before it's even created. And let's say you do overproduce a little bit. The next best strategy is to feed hungry people. Donate that extra food to food banks, soup kitchens, and shelters. After that, we see feed animals. Then following that, industrial uses for food waste, and then composting. And the least preferred method is to send that food to the landfill. So the pilot that you'll hear about from our next speaker is focused on the top two tiers. And we do know that our health systems are dealing with food waste at all of these levels. So I wanted to start us off with sort of 3 angles on why we need to reduce wasted food. The first one is for climate health. Wasted food accounts for approximately 20% of land, water, and fertilizer use, and 8% of global greenhouse gas emissions. And it's the most prevalent material type in landfills. And we know that in the landfill, food and other organic waste decompose and generate methane, a potent greenhouse gas that contributes to climate change. I encourage you to go to ReFed's website. They have a lot of great data and solutions for reducing food loss and wasted food. And just a note here that hospitals are incorporating food recovery into their system-wide climate mitigation strategies to address scope 3 GHG emissions. So the second angle here is food security. Up to 40% of the food in the United States is never eaten, but at the same time, 1 in 8 Americans struggles to put enough food on the table. And we know, and we heard David spoke a little bit to this as well, that this has gotten even worse in the pandemic. A recent report using the Census Household Pulse Survey found that food insecurity has doubled overall and tripled among households with children. And we know that this burden is not carried equally across racial and ethnic groups. It is even worse for Black and Latino families who have seen rates of food insecurity rise to more than 25%. So the third angle here is financial health. Every year, American consumers, businesses, and farms spend $218 billion growing, processing, transporting, and disposing of food that is never eaten. And we've seen this again with COVID-19's impact on food loss. We've heard about food rotting in the fields, dairy going to waste because of challenges in the distribution system. So all 3 of these angles are even more important in times of crisis. So in California, we have an extra push to reduce wasted food because of unique legislation outlined in California Senate Bill 1383, which sets organic waste reduction and edible food recovery targets. The legislation mandates that by 2025, there's a 75% reduction in organic waste disposal. And the really exciting part here is that 20% It also mandates that 20% of currently disposed edible food is recovered for human consumption. So this is obviously very important to our health systems in California, and they will be required to begin meeting these targets in 2024. So with that, I'm going to pass it off to our next speaker, Jack Brzee. We'll be talking about our food waste prevention and rescue pilot in Northern California. And Jack has 43 years of food service experience, and he currently oversees the food service operations for 10 of Sutter Health's acute care hospitals, which span across 8 counties in Northern California. You can read more about Jack on our website. And with that, I'm going to pass it off to you, Jack. I think, oh yeah, there you go. I think Jack's getting set up. There you go. Hi, Jack. I'm not hearing you, Jack. Are others hearing him?
Oh, Jack, I think you need to unmute your phone, perhaps.
Okay, how's that?
We got it.
Perfect.
All right, I'm so sorry about that. The technology challenge. Well, hello, everyone. I'm happy to be here to talk to you about our pilot program here at Sutter Health and what we're doing to prevent food waste and what we're doing to rescue leftover food and how we're helping feed our communities. This project is funded by the Department of Resources from Recycling and Recovery, or Cal Recycle, here in California. And California Climate Investments is a statewide initiative that puts billions of dollars of cap trade dollars to work reducing greenhouse gas emissions, strengthening the economy, and improving public health and the environment. This pilot is a collaboration between Healthcare Without Harm and Sutter Health, and Healthcare Without Harm is contracting with Copia to provide the application to our 10 Sutter facilities that we use to do our food waste and rescue program. So here's a little bit about what that program looks like. It's 10 of the hospitals that I oversee here at Sutter Health, and we partnered with Healthcare Without Harm, and we're using that partnership to use the Copia app across the 10 hospitals to work on food recovery and food waste reduction. So what is food recovery? It's taking our leftover food and getting it into the hands of hungry people. That's one portion of our waste reduction strategy. And the other portion is actual source reduction, as you saw at the top of Lauren's pyramid, is what can we do to prevent that overproduction so that food is never, so that it isn't potential waste. And we're, as I said before, we're using Copia to, as our tool in this process. So I talked about food waste reduction and getting food to hungry people. And I like to call that food rescue. So that's what we call it here at Sutter Health, is we're rescuing that food. We're preventing it from becoming trash or even compost. We're getting that food into the hands of hungry local people. So in my 30 years of working in food service, I've frequently thought about, how do I track? How do I make sure that we're not wasting food? And I've been working on it for a long time, and I hadn't developed my own system. So when Copia stepped up and said, hey, how about trying this application? Their sales pitch is that it solves the world's dumbest problem, getting edible food in the hands of hungry people. There's no way to talk about our pilot program without sounding like a Copia advertisement, so you're going to have to forgive me for that, because they're really doing the lion's share of the work in terms of helping us track and monitor our food waste. So what they do is, or what the app does, is it helps us measure our food waste They provide drivers to move the leftover food from our hospitals to our local community agencies. They're using Grubhub and Postmates, organizations that are already transporting food for local restaurants to people's homes. Now we're just using that to transport the food from our hospitals to our local community agencies. And they connect us with those nonprofits who can utilize our leftover food. The only requirement to be an agency that is a recipient is that you're a nonprofit in the areas where our hospitals exist. We have partners ranging from senior care centers to churches to shelters to food banks. Several people, including professors, mentors, and peers, have said to me, you can't manage what you can't measure. And I can't state that how important that is, that it's so true that measuring our food waste is what's important. This is a look at my dashboard. These are our actual results, January through September of this year. This is my Copia dashboard. You can see that we have rescued 45,000 pounds of food that would have become compost or even worse, trash, but that food got to be rescued and delivered to local nonprofits, and that food was able to be consumed by people who needed it. Our dashboard allows us to filter this data by a day, a week, a month, any time frame we choose. We can sort the data, and we can even export it into Excel so that we can manipulate it further to provide charts and graphs for our staff. We're going to walk through some of the charts and graphs during the presentation today to show you how the tool helps us do what we do. This is a look at our dashboard. On this dashboard, I've chosen to show you 16 Sutter Health hospitals. We started with a pilot for 10, and then 6 more hospitals from Sutter Health's 24 hospitals joined us. And so now we're all working collaboratively to rescue our food, track our food waste, and ultimately reduce that food waste, reduce it at the source. But this is a picture that shows what who those 16 hospitals are donating to, rather. So our 16 hospitals have 27 recipient agencies. You can see that those agencies are less, on average, than 4 miles from our hospitals. So that food is leaving our hospital, getting to those agencies where that food can be either distributed or consumed from there. Here's a slide that shows what we measure in our kitchens, the different categories. We customize these categories just for us so that when I'm looking at this, when my managers are looking at this, we're able to identify with those categories. We price each one of those categories. So behind this graphic is a cost for each of those categories. It can be drilled down by facility, day, reason code, such as overproduction, expired food, spoiled food, or contaminated food. We've been working on this food rescue piece for about 6 months. Now we've transitioned into our second phase, which is waste forecasting. Waste forecasting. We'll actually be predicting and setting goals for ourselves in terms of overproduction. That's where we get to the source reduction. We're looking at our waste by food category as well as by reporting by waste in dollars, all in an attempt to engage our different stakeholders. The employees in the kitchen, one set of stakeholders, they measure their progress in pounds. The supervisors and managers, they look at pounds, but they're concerned about dollars. Our hospital administrators, very concerned about dollars. While we want to be making a contribution to the community, we want to be reducing our expenses in any way that we can. And nothing says I know my business more than being able to measure your success in dollars. In the next few slides, we'll take a look at our program as it exists in our 10 hospitals. Here's a slide from Sutter Roseville. This is Chef Daniel. He has a lot of pride in his work, and here he is highlighting what Sutter Roseville is doing to make an impact on waste reduction and food rescue. So we're not sending the food to the landfill. And just by, in our first few months, just by measuring our waste, by getting our staff involved in, we're going, after we've fed the patients, after we've run the cafeteria meal service, we're going to weigh our leftover food. Just that process of having them weigh that food, we saw a reduction in the amount of overproduced food. There's truly the Hawthorne effect completely in practice, that when they saw that they were actually inputting those pounds into the application, we saw almost an immediate decrease in our measured waste. Here's a slide from Sutter Center for Psychiatry. Again, people who take a lot of pride in what they do. On this slide, you can see their process. Here, they're bagging the leftover food and tracking it in the Copia app and preparing the bags for donation. We chose to send our food chilled, so we're blast chilling that food, refrigerating it, and donating it either refrigerated or frozen to our recipient agencies, so we're not transporting hot food and expecting them to use it hot once it arrives at the agency, or expecting the agency to cool it down. We have the equipment and the technology to do that, so we're donating our food cold. When we rolled this out to the staff a couple of weeks before we rolled it out, we talked about the agencies we were going to be helping. We talked about the community benefits. That meant something to our staff. And so when it got to time to measure and track the food waste, there is some work involved with that. But our staff stepped up to that challenge and said, yes, it is a little bit more work, but we want to be making that contribution. They didn't want to throw the food away. They're happy to see the food go to use. And so they realized, and we've helped them understand their role in rescuing that food. And while coronavirus slowed our effort, it didn't derail us. In anything, it's made the food donations even more important to the agencies that we serve. Here in this slide, this is Sutter Auburn Faith. This is the paper towel dispenser where the staff wash their hands every day. And the manager, Catherine, there, she said, I'm going to list all of the agencies that we donate food to so the staff can see it. And so the staff started asking her questions about the agencies that they donate food to. Catherine is working with an intern on site right now to connect with those agencies and draw that connection even firmer between the hospital and those agencies, so that people in the department understand where their food is going and who's actually consuming it. And this is Sutter Auburn Faith. It's a rural community about 45 minutes outside of Sacramento, but still there were 5 agencies that were interested in receiving the hospital's food, even in that rural location. Copia has been successful in finding partner agencies, even in our remote communities, to receive our donations. And as I mentioned before, we're actually able to suggest nonprofits who might want to become recipient agencies. Again, the only requirement is that they are a nonprofit, they register with Copia to become part of our program. Here's one of our awesome food service workers from Sutter Amador. And this is what he says about the food donation. I'm supportive of the program. I used to volunteer to help feed the homeless. The homeless crisis is getting worse here. I think, man, there's so much food going to waste and all these hungry people. I don't mind giving a few extra minutes of my time to help people. And that's largely been the sentiment from our staff in our hospitals, because they know that their contributions make a difference. This is a note from one of our recipient agencies, from Sutter Amador Hospital again. You can hear the gratitude for the variety of foods that are being donated. This feedback comes to us via Copia from the recipient agencies. They check in with the agencies and they really manage those relationships, especially now when there's even more need to be in regular communication to keep up on closures, increased capacity, or the need for donations. All right, with that, I'm going to turn it back over to Lauren.
Thanks, Jack. That was great to hear from you on those. And I just wanted to close this out, since this is a partnership between Healthcare Without Harm and Sutter Health. I wanted to mention a few of the outcomes and sort of sprouts and things that we're excited about from this pilot. So the first piece is expansion to other systems. And you heard Jack speak about, oops, hold on a second. There we go, I clicked by accident there. You heard Jack speak about the expansion within Sutter Health system. And we're also excited about how this will, the learnings from this pilot will help to expand to other health systems. We're also interested in the creativity that we're seeing. Some systems are looking into ways to distribute additional food for pandemic relief and beyond. And it's really sparking a lot of creativity, and we're glad to see that and happy to help support that grow. We're also curious about community benefit. And this piece, you know, we're really excited to make those connections with community benefit. And you heard Jack mention it as well as you know, talking about how to make the case to his staff. But there really is a lot of connection with the community benefit department to learn more about and to kind of make those connections around food donation and aligning with their goals. And the last piece is a report. We are putting together updated guidance and metrics for measuring impact through Practice Green Health. And we're including results from Sutter's pilot program, and also taking a look at food recovery strategies and challenges in healthcare across the country. So you can look forward to that in the start of 2021. We should be releasing that. Again, thanks to our funders, Cal Recycle and California Climate Investments. And now we have about 12 minutes to move on to a Q&A. And I've seen a couple questions come into the Q&A function. And I want to invite all of our speakers to come on video so that we can, there we go, do this as a full team. Thank you. So John, had you pulled any questions right away? Let's see.
Yeah, so we have, first off, I saw someone asked about some of the links that were shared on the slides, and those have been put in the chat. So I know David put a link in, and there's also a link in the chat for our position paper on regenerative agriculture. So please check those links out in the chat. We have a question from a nurse that I think I'll just to throw out to everyone in case anyone has thoughts, but the question is, what can healthcare workers do to advance sustainability? I'm an RN, not an administrator. What can I do to help without direct influence over supply chains? I have some thoughts, but I wanted to see if anyone, I mean, Jack or David, if you want to speak to either of those things.
I have some thoughts too, but
Sure.
I would say you have a voice, use it. And whether that's talking to your administrators, whether that's talking to, you know, those who are doing purchasing, and talking to your patients. And I think that there's information around you, and, you know, from those of us who are, you know, practicing different pieces of this. But if this is an area that you're passionate about, or you care about, or you think is important, then asking hard questions and providing appropriate resources to those around you can really help to get some of these dialogues picked up by those who have administrative function or control. But if nobody says anything and nobody asks the questions, then surely nothing will get done.
Here, here. Jack, do you have any thoughts on that, or I can add a couple.
I'll let you go ahead.
Okay. Yeah. So I would echo what David said. Just, you know, using your voice, you know, inquiring, talking to your food service folks, and your if you have a sustainability, you know, you could join a green team if that exists at your facility. We also on the Healthcare Without Harm side, we have a nurses climate challenge, which I saw one of my colleagues put that into the chat. So please go ahead and click on that link. That gives you all the information you need in terms of how to join that. It's a network of nurses working together. So you'll have resources available to you through that as well.
Great.
Yeah.
Oh, I was just looking through the questions, and people are sending in some
Please.
awesome ones. Looks like there's a few questions specifically for Jack and then some specifically for David. So I'll start with one of them for Jack. A couple people are asking about the cost arrangement with Copia and sort of what it costs. So we can definitely speak to that. And then related to that as well, sort of who pays for the transportation of the food. So that's again connected to the Copia costs. And a question around, have you continued to donate food after and during COVID? And these are sort of all connected, I think. And then sort of any concerns around infection control as you're donating the food from the hospital. So I don't know, Jack, do you want me to take part of that, or do you want to start?
Let me take a swipe at it, and
Okay.
we'll work on this together, you and I, Lauren. So
Okay.
the cost for Copia, this is a grant-funded project, so I don't feel comfortable talking about our costs, but the link to get to Copia is gocopia.com. So I can say that there is access to get to someone from Copia who can talk to you about the cost. The cost of the transportation are woven into the costs with Copia. Copia pays Grubhub and Postmates to come and pick up the food and transport it to the nonprofit agency. So that's all part of the Copia service. I saw someone ask, did we continue to donate food even in light of COVID? The answer is absolutely. That's been even more important to me personally and to my hospitals, to make sure that we're taking all of our donatable food and getting it to people who can actually eat it. Someone had asked a question about food safety. There's a federal law and a state law called the Good Samaritan Act that protect us as a hospital from being sued by one of the nonprofits for sending them bad food. The Good Samaritan laws say if you would eat that food at the point when you donated it, then you're welcome to donate that to a nonprofit agency. So we've had no liability concerns, and our risk people reviewed that with us prior to moving on to this, or prior to getting into our pilot program. So the hospital feels very protected, that we're not putting the hospital at any risk there. See, did I miss something, Lauren?
There was one, you did a great job, but there was one sort of follow-up about, once you start reducing the amount of overproduction of food, how will that sit with the organizations who are starting to be really excited about the food that you're donating?
Well, I'm happy to address that. Currently, we're only rescuing half of our overproduction. So fully half of our overproduction is still generating waste in our hospitals because we don't have a perfect system. So as we look to reduce our overproduction, we're going to tackle that portion of food that isn't being rescued. That's going to be our first look, is to say, this food that we're not donating, how do we eliminate that first? And while our goal is source reduction, I've been at this, again, for greater than 30 years in healthcare. There is always going to be food to donate. So I'm not worried about that at all.
Great, thanks, Jack.
Yeah, so Lauren, I don't know if you had the next question in mind, but I did see one for David I'd like to pose to him. So David, how can hospitals participate in place-based investing without vastly increasing administrative overhead on financial decisions?
Good question. I think that I would say, there are right now, I say, limited resources out there to do exactly that, but I think an increasing number of investment consultants, where areas to access due diligence, other community partners to work with to spread out some of those costs. And I think the more kind of case studies and other examples to draw on can further reduce some of those costs. But right now we're seeing it's a relatively bare landscape, in some of these investments from healthcare systems into community and place-based projects. So it will likely take some overhead and somebody to kind of put their toe in the water to get this ball rolling.
Thank you.
I think we have maybe time for one more. And I saw, David, you had mentioned a question that came in from Callie Smolin, sorry if I'm pronouncing that wrong. What do you think are the pivotal first steps in addressing change within large corporations that run much of the industrial food system? Action often follows money.
Sure. So our organization is working a lot on the money side and trying to get some of those to shift. But going back to where a lot of the externalities of our food system lie, in the healthcare system, and I think that there are huge voices to begin to leverage within healthcare, and take it back to COVID and some of what we're experiencing today with kind of connections between immune system and diet and food production and climate. All of these things are interrelated, and to begin to have a public voice, whether it's on the policy side, whether it's in op-eds, whether it's folks starting their own blogs or newsletters, or just kind of beginning to support the science and support the communications and support the investment, we see rapid change afoot because of these messages and these silos that we've currently constructed in our society that separate, in many cases, health and food and environment, bringing those back together and treating them all as one. We're gonna get far, and we're gonna get there fast.
Great. Well, thank you so much. And we did get some more questions, so we will do our work to collect those questions together and get answers to the people who have participated in this call. I imagine they'll probably go up on the website with the slides as well. So if I could just have the slides back. I don't know how to do that. Oh, there we go. Awesome. Thank you. And I'll just close us out here. So we wanted to make sure everybody knew about our Plant Forward Culinary Contest. We have streamlined it this year for a much easier entry. So we hope that you will submit your entry anytime between October 1st and November 30th. And you can see the link here on the slide, and we can also drop that into the chat. Next slide. Do I have the slides? There we go. Okay. So again, we just wanted to thank you all so much for your support during this challenging time in healthcare. We are so thankful to have so many collaborators and champions on the call today. Special thanks to our speakers, David Lizax and Jack Brzee. As mentioned previously, we'll be providing a recording to this event, as well as the slides will go to all session registrants. Please join us for our next session, Rethinking Supply Chains in Response to COVID-19. That will be next week. And again, thank you for attending, and we're wishing you inspiration for the rest of your week.